Hi, let's talk about the vasculature of the orbit. The orbit and its contents are going to be served by the ophthalmic artery. The ophthalmic artery is a branch of the internal carotid artery. Recall that the internal carotid artery is going to enter the skull through the carotid canal of the temporal bone and will pop up on either side of the sella turcica here. And coming off of that internal carotid anteriorly is going to be the ophthalmic artery. That ophthalmic artery then travels along with the optic nerve, which we can see here, through the optic canal into the orbital space. And it is going to have many branches, some originating before the canal, some within the canal, some distal to the canal. Some of the major branches of the ophthalmic artery, even though we don't really go into this level of detail in this session, are the lacrimal artery that goes out to the lacrimal gland, and then the supraorbital artery, the supratrochlear artery. You can see that this bears a very close relationship with branches of V1. There's also a posterior ethmoidal artery and anterior ethmoidal artery making their way into the sphenoidal and ethmoidal sinuses, or various ethmoidal air cells along the way. And there's even a central artery of the retina that is going to be bound within the optic nerve, as we see, going out to serve the eye. In addition to the ophthalmic artery, we have ophthalmic veins, although we can only really, in this view, see one of them. The superior ophthalmic vein here takes its origin in the medial and the lateral aspects of the orbit, and this travels back through the superior orbital fissure. It is a means by which an infection can spread either from the angular vein of the face, or various facial veins, or veins draining ethmoidal sinuses, either anterior or posterior ethmoidal veins, and those infections can then travel back to the cavernous sinus and cause a blood clot, or a cavernous sinus thrombosis, which is a very serious condition if not promptly treated by antibiotics. And so there's also an inferior ophthalmic vein. We don't get to see this from this particular view because it's obscured by all of these orbital contents, but it mirrors pretty much the superior vein. Here we can see the posterior aspect of the orbit with the eye and the extraocular muscles removed, and here is cranial nerve 2, the optic nerve, and we can see the ophthalmic artery, or at least a large trunk of the ophthalmic artery, moving into the orbit through that optic canal. Here is a posterior view of the eye with the optic nerve cut, and we can see that central retinal artery bound within the optic nerve. It's very impressive. So there are also ethmoidal arteries. We don't have a very clear view of them here. We can see they're kind of obscured here by the superior oblique muscle, but those ethmoidal arteries are direct branches of the supratrochlear artery, which is a branch of the ophthalmic. And those arteries are going to serve ethmoidal air cells, the posterior will serve the sphenoidal sinus, and we'll see them come back into play when we discuss the nasal cavity as well. And then finally, we should talk a little bit about the cavernous sinuses. So just to orient, we're looking at the middle cranial fossa with the dura stripped away here. So here's the petrous portion. There's that ridge of the petrous portion of the temporal. There's the clivus. So here is that sella turcica. Here's our internal carotid artery. Here is the optic nerve. There's two. There's oculomotor. There's trochlear nerve. There's the abducens, and we could even see the internal carotid in there. And then here is trigeminal. So there's V3, the mandibular branch. There's V2, the maxillary branch, and then there's V1, the ophthalmic branch. So consider that the dura has been stripped away here, and specifically the meningeal layer of the dura has been removed here. So the wall of the cavernous sinus has been removed. And so looking into this space, we can see that the internal carotid artery and the abducens nerve, cranial nerve 6, traverse that cavernous sinus. And we can also see how 3, 4, V1, and V2 are embedded in the wall of that cavernous sinus. So the cavernous sinuses are dural sinuses, so they're between the meningeal and periosteal layers of the dura mater. They run, anteriorly from those superior orbital fissures, posteriorly back here to the petrous portion of the temporal bone. So they are in this space. There's a left and a right one. Anteriorly flowing into the cavernous sinuses, we have the ophthalmic veins, so superior and inferior ophthalmic veins. We have sphenoparietal sinuses, which we can't see here, and superficial middle cerebral veins, which we also cannot see here. They've been removed. And these cavernous sinuses are draining posteriorly into the petrosal sinuses, so the superior petrosal sinus and the inferior petrosal sinus. And what can happen is an infection, and this can come from the danger triangle of the face, so that area just lateral to the nose, or more often than not, I think the greatest propensity of these infections come from infections within the nose, so a boil or a furuncle within the nose can transport these infections back through to the cavernous sinus. And if they take root there, if there's an expansion there that compresses the contents of the cavernous sinus, so internal carotid, and most notably the abducens nerve, as well as impinging on 3, 4, and V1 and V2, which can cause a lot of problems. Now, in the pre-antibiotic era, a cavernous sinus thrombosis was very deadly. 80 to 100% mortality. In the post-antibiotic era, this mortality is much lower, so fewer than 1 in 5 or 20% mortality. And if found earlier, the prognosis improves with treatment. So we've discussed the various vessels which serve the orbit, namely the ophthalmic artery from the internal carotid and its branches, as well as the ophthalmic veins, superior and inferior, as well as the tributaries of the cavernous sinus. Thank you very much for your time.